I'm not going to touch Social Security, Medicare, Medicaid. None of that stuff is going to be touched.
Nothing.
You don't have to. Here's what I want on Medicaid. We're not touching anything. We're not going to touch it. And I'm not going to cut Medicare or Medicaid. Save Medicare, Medicaid, and Social Security without cuts. They're going to destroy our health care, but I'm going to save it all, and I'm going to save our country. That's what we're going to do.
What happens if it comes to your desk, has the tax cuts, but also cuts to Medicaid? Would you veto that?
Well, we're not doing that.
Would you veto that?
It's 7:15 and I am leaving the Capitol to head home to Delaware after Republicans passed the largest cut in Medicaid in American history, the largest cut in food assistance ever in this country. And that's not just me or House Democrats saying that. That's the nonpartisan Congressional Budget Office saying that. This is a terrible bill, but it was a close vote, a very close vote. And it now goes to the Senate, where we have more opportunities to take out the cuts to Medicaid, to help working people, not to line the pockets of billionaires and major corporations. But we need you to continue to lift your voice. It goes to the Senate, and it'll probably come back to us eventually again, if and when the Senate changes it. But this fight is not over. Democrats held the floor so that Republicans couldn't pass this heinous bill in the dark of night. The sun rose, and the public sees what House Republicans have just done.
Now, when you thought that the black Americans would be crying loudest in Trump's administration, then you have to listen to these white MAGA voters coming outrageously and lamenting the Trump cut on Medicaid that was of much assistance in the healthcare system in America. So as we watch this video, I want you to take a keen interest on how Trump gave promises not to interfere with the Medicaid, and this is coming contrary to what he had promised. And he has signed a beautiful bill, as he terms it, which is going to downsize the aid that goes to healthcare, and this will adversely affect the medical systems in America. So let's watch this and have a comment in the end.
America's healthcare system is already on the brink of collapse, but the cuts to Medicaid and Medicare that Republicans have been pushing through the last 2 nights in the middle of the night will cause total chaos. My name is Lex. I'm a nurse. I am quite literally waiting to go inside for my shift this morning, but I really feel like everyone needs a little bit of context as to why this matters and why this is so catastrophic. These cuts, and the cuts are in total over $1 trillion to both Medicaid and Medicare, will cause sheer and utter chaos in our healthcare system. Now, they want to cut over $800 billion to Medicaid alone over the course of 10 years. What does that mean? So that's roughly 10% of Medicaid's budget. Every year, Medicaid has around $800 billion to spend. So if you cut $800 billion in 10 years, that's 10%. Medicaid is the largest reimbursement of nursing homes, okay? Without Medicaid, and any cuts to Medicaid means your grandma and grandpa and your parents are going to be neglected in their nursing homes. And I'm not saying that because the staff is at fault. I'm saying that because when budget is cut, nursing homes cut staff. Right now, today, as I'm making this video, nursing homes are already making nurses take care of 30 to 40 patients. We can't be everywhere at once. Those ratios are about to grow. So a 10% cut to Medicaid does mean that there will be massive neglect in our nursing homes. It also means that some nursing homes are going to shut down completely. And that means that the hospitals you and I rely on, every single hospital in this country is going to have a delay getting people out of the hospital. People are going to sit and wait for discharge because a lot of the folks that come into the hospitals need to discharge to nursing homes, whether it's for rehab or long-term care or whatever. That's not going to happen. They're already full. The nursing homes are already full. Now they're about to get their budget cut. we are not going to be able to move people out of these hospital beds, you guys. And that means catastrophic levels of delays in care for everyone else. I don't know how much clearer I can be. If there are no hospital beds, there are no hospital beds. That means no beds for your car accident. Sorry, you come in with a broken femur and a broken pelvis. If we don't have beds, we're not going to treat you in the parking lot. We legally can't do that. So this is going to affect everybody. Private doctor's offices who primarily take Medicaid patients, if you go to that doctor and you don't have Medicaid, if they shut down, does it matter? Does it matter? Simply put, the disabled and the elderly are going to die because of these cuts. And Republicans know that. They know that. That's why they're doing these votes at 1 in the fucking morning. They know that only 15% of Americans, regardless of political belief, 15% support Medicaid cuts. That is one of the most unpopular policy positions in history. Not to mention all of the rural hospitals who will simply put shut down. A lot of these rural hospitals are almost completely reimbursed by Medicaid and Medicare. If they lose that money, they will shut down. A lot of them are already on the brink of shutting down as it is, which means that rural Americans, small town Americans, will have to drive hours to see a doctor. That means death. There's no other way to put this. So I hope that gives some context as to why every single person watching this video needs to be up their elected officials' assholes right now. You need to be calling and calling and calling, emailing. If you live in DC, go knock on that damn door. If you live near one of their offices in your congressional district, go knock on that damn door. We need to be in the streets. We need to be online talking about this. We need to be making as much noise as possible because our elderly deserve better, our disabled folks deserve better, and we deserve better.
Okay, so Trump's budget is already having an impact with regard to Medicaid cuts. And please interact with this video so I can stay out of algorithm hell. So there's $1 trillion in Medicaid cuts over the next 10 years. This is a primary form of health insurance for people who are in poverty, who have disabilities, and so forth. And already you guys may have already seen the one gentleman talking about how his wife's who works for a children's hospital, they had an emergency meeting with the staff about how are they going to be able to afford to take care of children. Now, if you've ever been in a children's hospital, these are the innocents. These are the innocent children who are battling really serious stuff to have to go to a children's hospital. They've got their burn units. This chokes me up because I used to do dog therapy there, bring my greyhound there. Cancers and all kinds of stuff. And, the staff at this children's hospital was stating that so many of the children they treat are on Medicaid. There's a lot of rumors by MAGA supporters at how this is going to save Americans money because illegals are no longer going to be getting Medicaid. They never did. They never could. And once you become naturalized, you still have to wait 5 years to get access to it. So this isn't going to hurt them or save us any money. It's only going to hurt Americans. It looks like 300 rural hospitals are preparing to close over the next couple of years. They were already struggling financially, barely staying afloat. One smaller hospital in Curtis, Nebraska just closed and said it was due to the budget cuts. Like they have been struggling to keep it open. Now, there's a lot of Republicans who live in these rural areas. So I don't know if you guys have ever been in an emergency situation where you call an ambulance and like within 15 or 20 minutes you're going to be at the ER. No, you better hope that you don't have to wait. You can hang in there for 40, 50 minutes, however long the drive is going to be. You're choking on something, having a heart attack. This is painful. Kentucky, the red state of Kentucky, is set to lose the most, $12.3 billion. Like other red states, it has one of the highest poverty rates. I don't know why these red states who have been perpetually in poverty keep electing Republicans that are helping to keep them in poverty. In Kentucky, it's looking like 35 rural hospitals will close and over 200,000 Kentuckians will lose their health coverage. So, yeah, we're just going to have to track all this. I'm really sorry for the people that this is affecting that don't deserve it.
My whole house is on Medicaid. My husband, me, our baby daughter. Okay, we're all on Medicaid. Without Medicaid, I wouldn't be able to have the birth control in my arm that I have. Without Medicaid, I wouldn't be able to have the antidepressants that I have at no cost to me. Without Medicaid, I wouldn't be able to go to therapy to continue to be the mom I am to the 3 kids and 2 separate houses that I have to do. Without Medicaid, my daughter wouldn't be able to go and get her vaccines and go and get all of the things that she needs as an 18-month-old baby. Without Medicaid, my husband wouldn't be able to go and get the medications that he needs and the treatment that he needs for his disability. Without Medicaid, not a single person in my house would have health care. We are low income. Our only income is my husband's SSI. We're on food stamps. We use food pantries. Okay? Without Medicaid, we would never be healthy. And for us, it's not even like body, it's all mental. For my husband, for me, and then we have a baby who needs Medicaid for vaccines, who needs Medicaid for, I already have 2 children who are diagnosed with autism. So what if she ends up getting diagnosed with autism? We need Medicaid. We need Medicaid. And if you live in America, everybody deserves free healthcare. That's it. I just love you.
So they did it. They finally cut Medicaid. I'm an emergency medicine doctor, and this is something that the Republicans have been talking about for decades. They finally got to it. 16 million people predicted to be kicked off health insurance over the upcoming years. 55,000 yearly preventable deaths because of this. Numbers are already crowded. They're about to get much more crowded. If you have no health insurance, the only place you can get care is an emergency department. So lots of people are going to show up to. From the ERs, we also discharge quite frequently to nursing homes and skilled nursing facilities, most of which are covered by Medicaid. And so now that 1 in 4 nursing homes are going to close, we're not going to have any place for those patients to go to. They're going to be in hospitals longer, and once again, hospitals are going to be more crowded. This is really bad. I wish there was a way to sugarcoat it, but this is really bad.
My dad lives in a nursing home, and by now I'm sure you've seen the video circulating about the woman who's really concerned because her dad is getting kicked out of his nursing home due to Medicare. And this is just the anticipatory changes that the big, beautiful bill is putting into place. What people don't understand is a lot of nursing homes are actually owned by these big corporations, right? So the big corporations, your local branch isn't that, but like they are owned like by private equity, things like that. Like I know the one that my dad lives in is like that. And so the rules kind of come from on top. So it sounds like some of these nursing homes are figuring, well, we're not going to get reimbursed from Medicare in the future. So we're going to just start evicting people who, you know, pay that way because we don't want to suffer the losses. And instead we'll try to fill those spots with people who pay out of pocket. Now, in my case, like my dad, we actually pay out of pocket, or I should say he pays out of pocket for his nursing home care. But what is it going to do when I guarantee you like 70-80% of the people who are at my dad's facility are in some type of Medicare reimbursement, especially if they're in like very long-term care situations. Like that is super common. I don't think people understand that. And so what's going to happen when these facilities can't fill the apartments because there's not enough people who can afford? I mean, to give you an idea, it's over $4,000 a month, guys. $4,000. I mean, think about like that. That's like almost triple my mortgage. Okay. It's crazy. And in my case, like what would happen if I was in this situation? Because I'm thinking about that. Like what's going to happen if like my dad's facility, for example, shuts because there's not going to be beds anywhere for these people to go. So the burden is going to be on the families. And like in my case, I don't have anywhere to put this man. And I don't live in a handicap accessible home. And there is no housing in my area. So I can't just like pick up and move. And I have a mortgage from 2011. Like I can't just move. Like, that's not really an option. So, like, I don't know what I would be doing if I was in that same situation. And I am really worried. And if you're thinking, well, I'm so lucky, I don't have anyone in nursing care, I'm not going to be impacted. Let me just tell you that this is just the one little arm of the ripple effect that this is all going to have, right? What's going to happen when hospitals aren't getting reimbursed for things? What's going to happen when your doctors are not getting reimbursed? They're going to go private practice. I'm telling you, this whole healthcare system is like on a house of cards. Like, it's all going to come crumbling down, and it's going to come crumbling down fast, unfortunately. So if you are worried about this, if you have loved ones that are going to be impacted, or you know you're going to be directly impacted by this, please know you're not in this alone. Please give me a follow, give me a comment, because I want to engage with people that are going through this same thing, because it is not easy and we need to come up with strategies together. And sometimes it's nice to just have somebody to vent to. So anyway, I'm here for you guys.
As a physician that takes care of Medicaid patients every single day, I want to talk a little bit about the bill that was passed yesterday, what it could mean for people like my patients, and what it could mean for the overall healthcare system. This bill specifically is going to require Medicaid patients to have strict work and reporting requirements in order to maintain their coverage. Here's what I see every single day. You have people that are recovering from surgery, you have patients with chronic diseases, you have people that are caring for family members that are ill. They just can't go to work to clock in. They can lose their coverage not because they're not willing to work, but because life just isn't sometimes that simple. Here's the biggest part of what you need to understand. If these patients lose coverage, they're not just going to disappear. They'll have to wait until their symptoms get worse, and then they'll show up in the emergency room. Not because they want to, but because that's their only option. That means diseases are going to be caught too late. Patients are not going to have access to medications they need, and there's going to be preventable emergencies. We already see this, but it's going to become more and more common. Here's the part that most people don't realize. When millions of people lose healthcare coverage, the entire system is going to feel it. So hospitals are going to take on more unpaid care. The costs are going to have to go up. Don't vanish. They show up in higher premiums, in overcrowded emergency departments, and limited resources for everybody. When one group loses access to coverage, we will all feel it eventually. This isn't about politics. This is about people. We need are policies that are going to strengthen access, support prevention, and value long-term health.
These kind of videos expose the PR nature of Donald Trump, because he has never been so meaningful and doesn't mean what he says. He acts opposite of what he had promised Americans, and it's so evident on how he's going to treat the healthcare system in America. Take, for example, the people who he removed from the streets last week of Washington, D.C., and he did it without giving an alternative to the homeless individuals, without giving affordable housing to these people. This comes again to healthcare. He has gone against the tenets of giving social amenities to people, the right to good healthcare, the right to get quality healthcare, and get subsidies on health. He has gone contrary to all this and is now downsizing the Medicaid that has been so much of importance to these Americans. And as much as people are crying and people are lamenting all this, there are far-reaching effects that would accompany all this, with the hospitals expected to be overcrowded, because everyone will now be looking for a way out of this whole mess. This is a mess that even the poor families would not get the right Medicare because of the high costs of living that is in America. You saw Moody's reactions on credit scores of America last week also, where Moody said that the credit scores of America has gone down and they are in a recess. This shows how Donald Trump's administration is not going well with Americans. In as much as the whites thought that this is their leadership and they saw Kamala Harris as belonging to the blacks, this is now hitting back at them. Not only blacks are going to be affected by all this system of interference on the healthcare in America, but the whites are at the center stage of all this because genetically they are not dominant. The blacks are more dominant on them, and they can really suffer. You saw what happened during the COVID-19. The whites suffered more than the blacks. So let us give a comment on this. Hit our comment section and tell us what you feel about Trump's move to remove Medicaid, which has been so much helpful in America. Also, do not forget to like, share, and comment. Thank you, and may God bless you.